One of the most common referrals that I get from friends and other doctors is upper eyelids, because 50% of my practice is revision surgery from surgeons that have done surgery on other patients. And one of the most common things I see is too much skin removed from the upper eyelids. When that happens, a person has trouble closing their eyes, which means that their eyes will get dry and irritated and red. And sometimes I even have to put a skin graft in to repair those upper lids. One of the more minor things that I see that is really a contour deformity is that the inside fatty cushion here is removed, and it gives a hollow in the upper lid area, and it looks like an A. We'll show you a picture of it. It's called an A-frame deformity. A lot of surgeons, when they're starting out, that fat cushion is very available to remove, and they take it out because it's an easy way to get rid of a bulge. But somebody like myself that's done over 30,000 surgeries, I never take out that fat cushion. I always reposition it, sew it back to where it belongs so a person will not get a hollow. Because what happens is a younger person might have that fat cushion removed, but as they get older, they're going to start having a hollow. So you might look good for a year or two, but 5 years later, it's going to be pretty obvious that you had surgery. So you'll have a hollow here, and you'll have an overhang here, and it is not a very natural appearance to your upper lids. The other thing that's important is the brow position. The brow and the upper lid go together, literally hand in hand, like a curtain rod and a curtain. And so it's important to make sure that you have the right balance, because a lot of times when there's heaviness of the upper lids, it sends a signal to our brain to raise our eyebrows. When you remove the heaviness, if you don't recognize that, you don't have that experience, the eyebrow will drop after surgery. Then the eyebrow to eyelash distance will get closer, and a person looks very stern. I have people come in all the time that say, I had my upper lids done. I feel like, everybody thinks I'm mad. I don't know why I don't look better. I went back to my surgeon. He said there's nothing I can do. And really what it is, it has nothing to do with their upper lids. I have to stabilize their eyebrow. Once I stabilize their eyebrow, then their upper lids look very natural. So there's a lot to the upper lids because everything comes together. And when you're looking at someone's eyes, that's what you're noticing, is the contours and the positioning and the spacing of the upper lid and the eyebrow. So make sure you go to someone with a lot of experience that has a true specialty and a passion for producing and helping somebody restore their beautiful eyes.